Hi guys, welcome to Radiology 365, where we try to cover core radiology from cover to cover. Today we are going to be talking about posterior mediastinal masses. The first I'll talk about are neurogenic tumors. A neurogenic tumor may arise from either a peripheral nerve or the sympathetic ganglia. Most adult tumors are peripheral nerve sheath tumors, and then the vast majority of tumors in children are of sympathetic ganglionic origin. Overall, neurogenic tumors are the most common paravertebral compartment mediastinal masses. Imaging features typically show a smooth, round mass. Benign pressure erosion of adjacent ribs may also be seen. You may also see erosion of the vertebrae, and also still due to this pressure erosion effect, you would have enlargement of the neuroforamina where the lesions may originate from. Interval growth of a neurogenic tumor with areas of internal heterogeneity should raise concern for transformation to malignant peripheral nerve sheath tumor. Now, peripheral nerve sheath tumors, which are more common in adults, like I said earlier, include schwannomas, which are the most common amongst the group, neurofibromas, and malignant peripheral nerve sheath tumor. In these images, we see a schwannoma, and this frontal radiograph shows a round opacity overlying the right hilum with the hilum overlay sign. You can see the vessels crossing it, meaning it is not a middle mediastinal mass. And this corresponded to a paravertebral abnormality on the lateral radiograph. CT shows a low density lesion without significant enhancement. MRI shows a heterogeneous T2 hyperintense signal and a hypointense signal within this cystic lesion, in keeping with a schwannoma. Still on neurogenic tumors, we'll talk about sympathetic ganglion tumors, and these are more common in children and young adults, and they include ganglioneuromas, which is a benign tumor of sympathetic ganglion cells, neuroblastomas, that's malignant tumor of ganglion cells seen in early childhood, and ganglioneuroblastoma, which is an intermediate between ganglioneuroma and neuroblastoma histologically. And this is seen in older children, much older children than would have been seen in neuroblastoma. Paragangliomas can arise in the paravertebral compartment of spinal, intercostal, or sympathetic nerves. Now in this image, it's a contrast enhanced axial CT, and it shows a paravertebral mass with heterogeneous areas of necrosis consistent with a paraganglioma, and this along the sympathetic chain. Then to extramedullary hematopoiesis, it presents as soft tissue paravertebral masses in patients with severe hereditary anemias, including thalassemia and sickle cell anemia. On imaging, we would see lobulated soft tissue masses that are typically bilateral or will also be seen inferior to the level of T6. They may also contain internal fat. This plain frontal radiograph shows a large paraspinal mass bilaterally with smooth lobulated contours, and this was a case of extramedullary hematopoiesis. Then to intrathoracic meningoceles, an intrathoracic or lateral meningocele is herniation of the leptomeninges through either an intervertebral foramen or a defect in the vertebral body, unlike the meningoceles that we've come to see occurring posteriorly. These ones would either be anterior or lateral, most likely lateral. Lateral meningocele is associated with neurofibromatosis. Now these images show a left paraspinal well-defined homogeneous cyst that's seen opposite the T10 to T12 vertebrae. This cyst shows intraspinal extension through a widened corresponding neural exit foramina. The intraspinal portion causes a patulous spinal canal and scalloping of the posterior aspect of the vertebrae. As you can see here, the posterior vertebrae are scalloped here. So this was an intrathoracic meningocele extending into the thorax, as you can see on the coronal. Now, a clue to vertebral body pathology on radiography may be a paraspinal line displacement. So in this radiograph, you can see displacement of the bilateral paraspinal lines here and here. And the sagittal T1 and T2 weighted MRIs show loss of disc space height and marrow edema, as you can see here. And there's also adjacent paraspinous phlegmonous change here and here, and that's what caused the spinal line displacement on the radiography. So these were paraspinal abscesses secondary to osteomyelitis discitis in this patient. Thank you very much for your attention. The next thing we'll talk about is airways, diseases of the airways. I hope, as usual, you are finding value from this discussion. If you are, give it a like, share to someone you think might need this, and leave a comment. Also, subscribe if you have not subscribed yet. And I will see you in the next one.